you've talked a lot about an educational type of approach and really having a supportive approach to your labs, both with your lab and your staff. So, from a leadership perspective, is this something you are intentional about? And if so, like how do you organize that intention, right? Because it doesn't just happen to build that type of a culture. And why do you think that this approach matters, like at this point in time?
Healthcare is in a difficult position, in my opinion, right now. And from talking with other people, mainly members of our board, we have 12 physicians on our board. We're going through trying times right now. And we could say this at various times through the decades, but right now, healthcare is struggling a little bit. To have the ability to have experienced, knowledgeable people to sit in a room or sit on virtual calls and to discuss these issues and brainstorm on how we can get through this, what we can do to come out better on the other side than where we are now is very important. And it's something that I feel we excel in. Sometimes you have to let your guard down a little bit and talk with people you wouldn't normally talk with because you need to make sure you have the entire picture of a situation. But I think that when we focus on what the concerns of our laboratories are, that we can sit and have intelligent discussions with action-based results at the end of the discussion being the focus, then we come out better and our laboratories come out better. COLA has expanded well beyond just physician office laboratories. We love POLs. We service many, many POLs. We love giving guidance to POLs, but we can do so much more with so many different types of laboratories. So we were a little nostalgic keeping commission on, and we made sure that we didn't restrict ourselves with the first name with office laboratory, but laboratory accreditation in general. That means all sizes, all specialties. And we've also launched our ISO program. This is another way to ensure a high quality laboratory, different mindset than our regular CLIA accreditation, but Commission on Laboratory Accreditation encompasses all of the high quality laboratory focused standards that we offer and will be offering in the future.
Do you feel like it was easy to bring people along with the change, or did you have some people that were historically kind of like stuck on not coming to that change and that vision?
It was really interesting because we surveyed our team, internal team, and when we found out how many people were asking, what does COLA stand for, when it really wasn't an acronym at that time, that made it easier for us internally to come up with the answer to the question. And I really have not seen a resistance out in the laboratory industry. So I think it was well received, or from my
Nancy, under your guidance, you've really helped guide COLA through a lot of major changes. You've talked about many of them here, workforce and the pandemic, et cetera. But there's also a lot of new opportunities for your organization. So what are a few innovations or developments that you're excited about or really proud of, and why?
Well, I'm about to sound like a broken record because, again, I'm going to say we now have CMS deemed status for all CLIA specialties, and that allows us to be the right accrediting organization for all laboratories of all sizes and all specialties. We're also very cost effective without compromising quality. Our staff obtains continual training throughout the year to make sure they stay abreast of the changes that occur within laboratories. And this information is relayed to the laboratories. And as I previously stated, the launching of our ISO accreditation program, beginning with the standard 15189, which is for laboratories, is a real asset. It's something we're very proud of. We can continue what we've been doing all along, but now expand this to a larger audience.
But from your perspective, where does COLA sit, and what role do they play in helping labs think beyond, just the day to day, but to the future and long term sustainability?
Clinical Lab 2.0 is an initiative of Project Santa Fe Foundation, and I'm on the board of the Project Santa Fe Foundation, so extremely involved in Clinical Lab 2.0. And that brings together many different organizations, many different individuals to have these deep discussions. There's a open workshop in the spring, and then there's invitation only colloquium in the fall, people together to discuss the challenges. Number one, a payment of the future. Number two, how is the laboratory going to be such an integral part of healthcare? There's so many factors that laboratory could be pushed aside. There's workforce issues. There's the increasing number of wave tests out there. The thought that anyone can run a test. I love the fact that we have home tests, but you still have to do it right to get the accurate result. So it's important for us to look at the importance of the laboratory as it pertains to healthcare. And the data we have, the trajectories that can be determined on an individual patient's care when you're looking at it from a laboratory perspective is needed in healthcare. The whole Make America Healthy Again push, Clinical Lab 2.0 goes right along those lines. Let's keep people from getting those chronic diseases. Switching back to the Workforce Action Alliance, that came about just from a discussion. We had a laboratory enrichment forum. We had a workforce shortage panel, and we asked, what can COLA do? And the response was, bring us all together. There's so many organizations who have their own initiatives. Just bring us all together to work on some, because when you get a good group together, there is so much power and so much emphasis to push it along farther. And all of the organizations still have their own initiatives, and some of them we work on outside of WAA, but bringing us together has been wonderful and really given us an opportunity to do more or spread the word about more things. Leading Laboratories from ASCP is a great example. They started out, they had an alliance with one accrediting organization that has expired, and now it's opened up to all accrediting organizations. And there's criteria to be a leading laboratory that we need to embrace, because when you look at nurses and the magnet institutions and how nurses are really looked at in a different way if they're at these facilities, that's what we want from laboratories. You're a leading laboratory. You work at a leading laboratory, it's on your resume. We need to get to that level with the ASCP leading laboratory. And then when you stop and think, what can we do for individuals beyond the Workforce Action Alliance? COLA has an internal program called Give Back 365. We provide scholarships annually, and that is so rewarding to us. We have a whole internal team where we review the essays and we look at the importance of the individual on their outlook for their laboratory career, not using the laboratory as a stepping stone just to go to be a doctor. Nothing wrong with that. But we're looking for retention within the laboratory itself. So long-term sustainability with a dedicated workforce is very vital to the future of healthcare. And that is something that I strongly feel COLA is promoting and doing our part. We're always open to hearing any other suggestions, but we are working very diligently in that aspect.
Yeah, so you've touched on so many things. 'Cause my next thought was just asking about the future with all the changes and things, but you've touched on the workforce, the multifaceted approach that COLA is taking to bring people along and kind of push them forward. So to kind of build off of that a little bit with AI, molecular diagnostics, and all of these changes coming along that you've kind of touched on a little bit, where do you see some of these accreditation organizations, like where do you see COLA having the biggest opportunity to lead? Are they in the initiatives that you've already kind of talked about? Are there additional things like with molecular testing and AI where you think COLA and other accreditation groups can kind of lead the way on?
Well, we need to keep an eye on regulations, especially for AI, because we need to understand the federal government stance on AI regulation and make sure we align with it for CLIA standards. ISO accreditation, you look at a broader picture. So, sorry, I lost my thought. ISO accreditation, looking at AI, is a little bit different than our CLIA accreditation. But when we're talking about laboratories bringing in new technologies that have AI, we need to be very aware of what's going on, which is why we work with manufacturers. We want to know what the new technologies are that are coming out. So we best understand how our surveyors need to look at this when they're out in the field. Molecular diagnostics is just exploding. Fortunately, COLA is fortunate to have so many surveyors with a lot of molecular background. And of course, they keep up continuing education, and we bring in subject matter experts to train all of our staff, if they don't have that background, to understand how it's changing. It's so important to be part of the discussion with Congress, talking with other physicians more than our board has. Being part of the conversation, making sure that we are collaborating with the right organizations, working with our board members who are all physicians to make sure we're getting their perspective on healthcare and how all of the changes that are affecting laboratories are affecting their patients. And I think that's where COLA has the advantage, because we have pathologists on our board, but we also have a variety of other specialties on our board. And that different perspective is just a huge benefit to us when we're working on standards, when we're working on how our surveyors go out and talk with laboratories. So I think all of those are things that we at COLA need to do.
And having people from other subspecialties on your board adds a lot, because we're looking at the entire patient, and it's how does lab impact the patient as a whole? So you need to involve the other team members for the future. So I love that.
And it's so interesting because when you talk to different physicians, their response is not, oh, I pick up the phone and call the pathologist first. It's usually they call the specialist in their group or who their group associates with so much. That's where the pathologist or DCLS need to be known as the experts who can assist the physicians better. That's another thing ClinLab 2.0 is working on. Let's make sure that all of the physicians out there who have so much on their plate already understand that the laboratory can be a benefit. The laboratory can help them in patient care.
So, when you think about the future, particularly your tenure as CEO with COLA, what do you hope that they will say about the organization and your impact that you've made on patient care?
Well, our vision statement is COLA Inc. will be recognized as an organization that consistently has a positive impact on health and safety. That means we have to be consistent day in and day out, and that is something our staff has committed to doing. We have a dedicated 12 physician member board of directors. And if you're not aware of COLA's board of directors, we have representation from the American Medical Association, from AMA, from the American Academy of Family Physicians, AFP, and American College of Physicians, ACP. And then we have our board elected members, and that includes pathology. And they help guide COLA's framework to provide the best accrediting experience for laboratories. With our guidance through accreditation, patient safety can improve greatly. And that's what I hope people will say about us. Oh, COLA came in and COLA did make a difference.
That's great. I mean, that's a good, you'd hope somebody would say that about anybody, right? That you came into your field and you made a difference and you left a legacy, right? We talk about that a lot as a group here, even just like, what's our legacy to the lab medicine community? And so that's awesome that you're already training up surveyors and your culture and your organization to think that way, right? Like, what are we leaving behind? So as a leader, and in that space, and when you're thinking about the conversations that we've had and just in general, like what you just talked about in terms of like your legacy, what encouragement or advice would you want to leave people with, lab leaders specifically, as they navigate healthcare and all the changes in our environment day to day? It's never the same.
That is so true. It is never the same. But the one thing that is consistent is we are here to help. COLA is here to help. And with our collaborations with industry leaders, education resources, our whole approach to laboratory accreditation, we're here to help promote the laboratory of the future. So we want to have these discussions. We want to ensure high quality patient laboratory results. We want to.
When people are listening to this episode, what do you hope kind of stays with them?
Well, I hope if there are listeners who remembered COLA from years past, they now understand that we can accredit so much more than how we started. We started to fill a need when a need arose. That's how we were implemented. But we have gone beyond that. We are able to go in and have discussions. We're able to go in and educate. We're able to go in and assist laboratories improve their processes to get it to the point where they want it to be. And of course, I can't leave this without saying, if you're looking for a high quality, non-punitive laboratory accreditation for all types and sizes of laboratories, well, then COLA is the premier accrediting organization you would be wise to choose. Have to throw that sales pitch in there because I
You do.
sincerely believe it. And I wouldn't be here this long if I didn't believe every word of that.
It's good that you are a champion for your organization and a champion for the profession. And we really appreciated the time you've given us to just chat with us, three lowly laboratorians.
Yeah.
You're not lonely.
So we really appreciate you just answering our questions and taking time to really like explain what COLA is and your vision for the future and the organization's vision for the future. And yeah, we love that we get to talk to champions like you, and we're inspired by your journey. So for all of our listeners at SUPERSTAT, thank you for tuning in, and we look forward to talking to you next time. Bye.